Good afternoon, everyone, and thank you for being here. I want to thank Dr. Arwady and Dr. Luna from the Department of Public Health. I want to begin by taking a moment to condemn the unconscionable shooting that took place in Atlanta and suburban Atlanta yesterday evening. It took the lives of 8 victims, at least 6 of whom were women of Asian descent. Make no mistake about this was a hate crime. It was a hate crime against, obviously, the immediate victims, but it was a hate crime against our entire Asian and Pacific Islander communities. This was a crime against Asian women. And this was a crime that has shown a harsh light on the anti-Asian violence and hateful rhetoric that has been on the rise since COVID-19 became a global pandemic and fanned by the hateful rhetoric of our former president in this country. To be clear, any crime against any one of our communities is a crime against all of us. We have to treat it like that. We have to feel it in that same way, and we have to attack these hateful acts in that vein. Especially since COVID-19 came to our country, Asian Americans have been hit with an especially vicious wave of racist vitriol, leading them in their businesses to suffer, leading them to be disproportionately targeted and attacked. And on top of that, having to deal with the ravages of COVID-19 as it swept through their communities. We have to be better than this in our city, in our state, our country. And in Chicago, we can't ever give hate any opportunity to take root. So to our Asian and Pacific Islander communities here in Chicago, I want you to know that I and we stand with you. We will be united in supporting your communities. And I will continue to do everything in my power to protect you. I checked in with the superintendent right before this press conference. And I want to remind folks, and hopefully this will be of some comfort, we have no actionable intelligence regarding a specific threat against our Asian or Pacific Islander communities here in Chicago. Nevertheless, the superintendent has directed that our officers remain diligent, and they will. And specifically, district commanders have initiated outreach with local community leaders, advocates and business owners throughout the Asian and Pacific Islander communities. In addition, the CPD will increase their presence and patrols in these same communities. And I want to say directly to our neighbors and our friends in the Asian and Pacific Islander communities, you are not alone. We stand united with you, and if you see something, please say something. Call 911. Use the CPD anonymous tip line, or contact our mayor's office of engagement. We will and we must be here for you. Now, let me turn to some more joyful news. We are here to announce that because of the progress that we've made today in fighting COVID-19, that we will move into Category 1C as planned on March 29th. This is good news for the tens of thousands who are anxiously awaiting their turn to get the life-saving COVID-19 vaccine. Since the arrival of these life-saving vaccines to Chicago back in December, we've been intentional about getting them to residents who need them most, rolling out initiatives such as Protect Chicago Plus and deploying our racial equity rapid response team to ensure equity remains at the heart of our distribution strategy, and working with our partners at the federal level to obtain more vaccine and open mass vaccination sites like the United Center. Simply put, because of the hard work and sacrifice of so many across our city, we have the opportunity to open up vaccine opportunity to more folks, and that's what we're doing, both in continuing the ongoing fight against COVID-19 and also in other life-saving work of getting vaccine to our residents who need it most. This has been a courageous, important, difficult, but ultimately successful initiative citywide with many, many people who have made this work happen. And let me give you some examples. We talked briefly about Protect Chicago Plus and where we've brought a vaccine to areas of our city that need it most. And thanks to these efforts, we have made great progress. Back in our Phase 1A of our vaccine rollout, when the focus was on healthcare workers and long-term care facility staff, at that point, less than 20% of vaccines were going to Black or Latinx residents. Now, that figure is over 50%. And data show that communities where the Protect Chicago Plus program was initially launched are seeing the fastest rates of increase in vaccinations in our entire city. When comparing coverage from the beginning of March, communities like Gage Park, South Lawndale, Belmont Cragen, and Archer Heights are now doubling, tripling, in some instances quadrupling the rate of people getting vaccinated. And now, as I said, we are here to announce that we are planning to move into Phase 1C. Now, Dr. Arwady will go into more detail in a moment, but I do want to explain what this shift to 1C does and does not mean. What it means is that starting 2 weeks from now, on March 29th, vaccination eligibility will be expanded to residents who have underlying conditions, essential workers such as restaurants, hotels, hairdressers, clergy, construction, delivery, and warehouse workers, just to name a few. Additionally, we will continue to vaccinate residents who are already eligible in 1A and 1B. And I want to particularly give a shout out to our seniors. We need to get you vaccinated, but more to the point, you need to get vaccinated. We need to continue that hard work of making sure that as many of our seniors as possible have access to the vaccine. So if you are eligible under the earlier phases or now, please don't hesitate to take advantage of the opportunity to get vaccinated. Contact your local health provider or visit ZocDoc, that's Z-O-C, doc.com/vaccine to get signed up. That's ZocDoc.com/vaccine. And as always, continue to visit chicago.gov/covidvax, where there's a vaccine finder to assist people eligible for appointments. Additionally, if you know someone who is eligible under these phases, please do everything you can to help them get signed up and get them vaccinated. Now, what this shift to Phase 1C doesn't mean is that we'll have enough vaccine for those who are newly eligible right away. We are optimistic that we will continue to see a steady flow of vaccine in March, that April will even look better. But we want to make sure that we manage folks' expectations. It will take us some time because of the limited supply that we are still getting. But hope is on the way. We are expecting to receive more vaccine over the course of this next phase, and that will and that all those who are newly eligible under 1C will be able to get and make a vaccine appointment in either April or May. This shift doesn't mean that we should stop doing what we know has worked throughout this pandemic. Let me remind folks, you got to wear a face covering when you go out. It's critically important, the most important tool that we have to help prevent the spread of the virus. It means you also have to continue social distancing, not gathering in large groups, wash your hands frequently, and continue to wear a mask, and avoid all non-essential travel. I just want to share with you one last thing before I ask Dr. Arwady to come to the podium. I started my day today at the United Center, at the mass vaccination site there. And I got a complete tour as folks that were moving in to get their appointments. And I have to say it was an absolute wonderful thing to see. Of course, because it's St. Patrick's Day, the Shannon Rovers were there to serenade folks as they came through the line. And whether you were in a wheelchair or whether you were able to walk on your own volition, people were moving through this facility in record time, but without any issues. And spontaneously, people came up to me after they had received their vaccination to compliment the team of folks that were there on how efficient it was, how they were pleased to get the vaccine, and that being there at the United Center site was easy and painless for them. And that's to the credit of many, many people, and I've said this before, but I think it bears repeating. First and foremost, we have to thank the federal administration, the Biden administration, for recognizing the importance of these kind of sites and placing an emphasis on equity. I want to thank FEMA in particular. I want to thank the Illinois version of FEMA, IEMA, led by General Tate Nadeau. I also want to thank the National Guardsmen who were there. There were many who were there from out of state, some from Kentucky even, and other places, who were sacrificing to be here in Chicago to help protect Chicagoans. So we owe a great debt of thanks to them. And of course, the owners of the United Center, the Reinsdorf and the Wirtz families, who have been tremendous partners to this city throughout the pandemic. But this really takes a village, whether it's at the United Center, whether it's at our other city pod sites, whether it's through the work of the pharmacies, CVS, Walgreens, Jewel. There's a tremendous spirit of collaboration and partnership across the city that is truly saving lives every single day. And we can't lose sight of that. There have been many times over the course of this last year where we've all had reason to despair. Particularly a year ago, when we didn't know what the future was going to look like, and there was more uncertainty than not. But we've weathered a lot of storms over the course of this year. And I will just say, what I came away from that experience feeling today, well, a memory that I will have with me for the rest of my life, is that God's grace is shining on us. There is truly light at the end of the tunnel. We've got to stay diligent. We've got to continue to work hard, but we are moving exactly in the right directions. And I am grateful for the work of so many, more than I can possibly name, who have gotten us to this point. One of whom, of course, is our own Dr. Allison Arwady, the Commissioner of Public Health. Doctor.
Thank you very much, Mayor. So we are 12 weeks into our vaccination campaign in the United States and here in Chicago. 12 weeks and 1 day ago is when the first vaccine was administered at the Loretto Hospital here in Chicago. And in 12 weeks, more than 110 million COVID vaccinations have already been given across the United States. Here in Chicago, we'll cross the 1 million mark in about a week. And the data couldn't be better when we look at how these vaccines have performed from a safety standpoint, from an efficacy standpoint. The fact that we can be standing here in March already talking about an expansion that will make most Chicagoans, many Chicagoans, eligible for COVID vaccine is really a tribute to scientists around the world and around this country that worked to bring a vaccine, a safe vaccine, in record time. Approximately 1 in 5 Chicago residents has now gotten at least a first dose of vaccine. If you limit it to adults, we're at nearly 1 in 4 Chicago residents has gotten at least a first dose. And where we look at Chicagoans over the age of 65, we're at nearly 1 in 2, about half. And although that is great progress, particularly as you heard the mayor say, folks over 65, we're not done yet. And our priority before we move into 1C on March 29th is to keep getting our seniors vaccinated. So let's take a quick look back. For approximately the first 6 weeks of vaccination, from late December into January, we were in phase 1A, focused on healthcare workers and long-term care residents. Chicago was getting less than 5,000 COVID vaccine first doses every day to stretch across the entire city. As vaccine confidence has grown and vaccine supply has grown, everyone who is eligible in 1A has now had repeated opportunities. And we estimate that approximately 70 to 75% of the people who are eligible in 1A have now gotten at least a first dose of vaccine. In late January, we opened up to Phase 1B, which means that in February and in March, we've been focused on vaccinating people 65 and older and frontline essential workers, with a particular focus on getting vaccine into the hardest hit settings and communities. We've also continued to vaccinate the people who became eligible in 1A, and we have successfully made second doses available on time to every Chicago resident who has gotten a first dose of vaccine. We have continued to use every dose of vaccine that we have received with no vaccine going to waste. We've hit every benchmark on efficiency, putting more than 95% of our vaccine into arms within 7 days of receipt. And importantly, vaccine supply has continued to increase, so that besides what the city is directly receiving, which is up to between 9,000 and 10,000 first doses per day now, there are also direct federal allocations that are coming to pharmacies and to sites like the United Center. And so we're now getting more than twice as much vaccine as we were getting in Phase 1A. It's still not enough to meet demand, but it is a major improvement. And that means by the end of March, we will have been able to offer vaccinations to enough of the 1B group to, as the mayor said, move to vaccination Phase 1C on March 29th. This marks a major increase in eligibility, and that means that in April and May, we will be focused on vaccinating people with underlying conditions and essential workers, especially those who can't work from home. But we're going to keep our focus on anybody who didn't get the vaccine yet in 1A or 1B and continue to make sure that where people are getting a 2-dose vaccine series, they get that on time. 1C will include Chicagoans with underlying conditions that put them at increased risk for severe COVID outcomes. It also includes other essential workers with a focus on those who can't work from home. So as you heard, that includes warehouse and delivery workers, restaurant and hotel workers, people who cut hair and do nails, construction, retail workers, and people who work in shelter and housing. We'll be providing a detailed list, both of underlying conditions and of the essential jobs, on chi.gov/covidvax. And I want to emphasize that between those with underlying conditions and essential workers and everybody in 1A and 1B, most Chicagoans will actually be eligible to be vaccinated beginning March 29. But just because you're eligible, it doesn't mean you're going to be able to be vaccinated right away. It's all going to depend on vaccine supply. We do not have a large amount of vaccine to release onto ZocDoc on March 29th because we have no vaccine sitting on shelves. And while you should continue to check ZocDoc.com for appointment availability, please know that this supply is going to ramp up over the next couple of months. Just like when we moved into 1A, we didn't have enough vaccine for everybody at the beginning. Just like when we moved into 1B, we didn't have enough vaccine for everybody at the beginning. But as we get further into the phases, vaccine supply has opened up, and I'm confident, based on everything we're hearing from the federal government, that the same thing will happen. So if you are in 1C and you're anxious to be vaccinated, assuming the federal protections hold, we do expect you'll be able to make a vaccine appointment in April or May. Underscore, April or May. It's likely to be May before we have enough vaccine to be able to partner in large ways with employers at a significant scale. And to be clear, we're not going to be done vaccinating Chicago in May. We'll definitely still be vaccinating hundreds of thousands of Chicagoans through the summer and beyond, but this is going to start feeling more like a traditional flu vaccine campaign, where the problem is not finding a vaccine, it's having the confidence in making the decision to get a vaccine. And we will continue this focus on seniors, especially between now and when we move into 1C. If you know any Chicago resident who is 65 or older who has not been vaccinated, you can also please help them call 312-746-4835. We have more than 200 contact tracers standing by. They're not as busy right now because our COVID cases are under good control. So some of them are working at the pods, and 200 of them are taking appointments, and they've booked more than 17,000 appointments by phone just in the last few days, many for seniors. I want to thank those folks, and again, please, we want to get our seniors as heavily vaccinated as we can. Our focus in Protect Chicago on prioritizing vaccines to the settings where COVID is hit hardest has paid off, as we've brought vaccine to long-term care facilities and homeless shelters and senior independent living facilities, which we will have brought strike teams, mobile vaccinations, to every independent senior living facility by the end of March. We've already prioritized vaccine for our first responders, CTA employees, grocery store employees, child care workers, manufacturing settings or more. And then obviously through Protect Chicago Plus, we've gotten vaccine to the communities hit hardest by COVID. And so over these last 12 weeks, the good news has not just been about vaccination numbers coming up. It's been about this drop in COVID cases, this drop in COVID positivity. And although a lot of that is because thank you to every one of you who has continued, and we need you to continue to do the things that protect us all. It also is because we've managed to get vaccine to the settings that are most driving our outbreak. And over the last month, I'm thrilled to say not only are our numbers lower, we've essentially erased the racial and ethnic inequities in COVID case rates and deaths that have plagued COVID since the beginning. Getting vaccine first to the highest risk settings has the biggest impact in driving down case rates. It helps protect every one of us from the emergence of variants, and it moves us closer to reopening and getting back to normal. And so the last thing, as we look ahead beyond that, we had previously projected being able to move to phase 2, which means all adults, at the end of May, with a focus on getting those folks vaccinated in June and July. I was honestly surprised to hear President Biden call for eligibility for all adults by May 1, since the vaccine supply we've received to date in Chicago would not necessarily support that timeline. But I'm taking it as a sign that the federal government is confident that vaccine supply will ramp up even faster over the spring. And as vaccine supply ramps up, we are more than ready here in Chicago to get it into arms. We have nearly 600 healthcare providers registered, trained, ready, and anxious to vaccinate their patients, most of whom haven't been able to start vaccinating yet because we haven't had supply. We have plans for scaling up more mass vaccination sites. We've just been waiting for vaccine. And we'll keep a continued focus on reaching vulnerable Chicagoans, like those who are homebound or less connected to medical care. Just as we've done every day for more than a year, we will be looking at our data every single day. We'll be adjusting operations where we need to ensure this vaccine reaches across Chicago and gets us past COVID. I want to clarify that beginning March 29th, only Chicago residents will be able to be vaccinated at City of Chicago vaccination sites. We've asked healthcare providers to continue prioritizing vaccination for their existing patients who have the most underlying conditions, so we don't require residency requirements for you to get vaccinated with your regular doctor. When we are doing employer-focused vaccinations, which is likely to be able to begin probably more in earnest in May, we also will not ever require a residency requirement if we're at a site vaccinating. But for public City of Chicago vaccination sites, like those that will be available on ZocDoc, at least for the next couple of months, we will be limiting that eligibility for Chicago residents. So keep checking with your healthcare provider, keep checking ZocDoc. Again, more vaccine is coming. April or May is going to be your opportunity to get vaccinated in phase 1C in Chicago. And with that, I'll bring up Dr. Luna, who's going to give some remarks in Spanish. Thank you.
Thank you, Mayor. Thank you, Commissioner Dr. Arwady. Y buenas tardes a todos. Gracias por estar aquí. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y tengo buenas noticias, pero vamos a empezar con una pequeña reflexión. Esta época, el año pasado, fue una época particularmente difícil para nuestra ciudad. El 16 de marzo perdimos a nuestro primer ciudadano de Chicago. Su nombre era Patricia Frison, residente de Auburn, Gresham, y enfermera jubilada. Luego, un día después, el 17 de marzo, nuestras escuelas públicas suspendieron el aprendizaje en persona. COVID interrumpió nuestras carreras, nuestra vida. Nuestros estudiantes se vieron completamente aislados y mucho más ocurrió a partir de ese momento. Al pensar en estos eventos o aniversarios solemnes, es fácil enfocarse en todo lo negativo, en todo lo que hemos perdido durante el año pasado. Sin embargo, estos aniversarios también nos brindan una importante oportunidad para reflexionar sobre todo lo que hemos ganado este último año. Además del progreso que hemos logrado para dejar atrás esta pandemia y dar un paso hacia la recuperación histórica que seguramente vendrá después. El núcleo de nuestra capacidad para avanzar este periodo de recuperación son las vacunas, que han demostrado ser la luz al final de ese largo y oscuro túnel que es el COVID-19 y en el que hemos estado todo este año. Desde la llegada de las vacunas que salvan vidas en diciembre, hemos tenido la intención de llevarla a los habitantes que más la necesitan. Hemos implementado iniciativas como Protect Chicago Plus y hemos desplegado nuestros equipos de respuesta de equidad racial para garantizar que la equidad permanezca siendo el centro de nuestra estrategia de distribución. Y trabajar con nuestros socios a nivel federal para obtener más vacunas y abrir más sitios de vacunación masiva como United Center son la esencia y el motor que nos guía en este paso a la distribución de la equidad y para dar esas vacunas a las personas que más lo necesitan. Gracias a estos esfuerzos, hemos avanzado mucho en nuestra misión de vacunar a todos en nuestra ciudad. Si bien al principio del lanzamiento de la fase 1A, cuando el enfoque era para personal de la salud y nuestros pacientes de la tercera edad viviendo en lugares de cuidado a largo plazo, la recepción o la aceptación de la vacuna fue de un 20%, en nuestros habitantes latinos y afroamericanos de Chicago, ahora la cifra es más de un 50%. Y eso sí que es un avance. Y los datos muestran que las comunidades donde se lanzó inicialmente el programa, Protect Chicago Plus, han experimentado el aumento más rápido en la tasa de vacunación de toda la ciudad. Al comparar la cobertura desde el principio de febrero hasta principios de marzo, comunidades como Gage Park, South Lawndale, Belmont Cragen y Archer Heights están viendo duplicar, triplicar y cuatriplicar la tasa de personas vacunadas. Y ahora estamos aquí para anunciar que todavía estamos planeando una fase muy importante, nuestra fase 1C, como ya nos explicó nuestra comisionada. Esto significa que a partir de 2 semanas, ya el 29 de marzo, la elegibilidad para la vacuna se ampliará para todos los habitantes que tienen afecciones subyacentes y trabajadores esenciales, como nuestros trabajadores de restaurantes, nuestros trabajadores de hoteles, peluqueras, las personas que hacen uñas, trabajadores de construcción, entrega, almacenes y también nuestro personal clérigo, o sea, las personas, nuestros líderes de la fe. Además, también continuaremos vacunando a estos habitantes elegibles o todos los que son elegibles bajo la fase 1A que decidan vacunarse, están a tiempo. Y la 1B seguiremos vacunando a todos esos. Entonces, para visitar y para ver los requisitos y saber si ya le toca su vacuna y que no se pierde esa vacuna que salva vidas, por favor, visite socdoc.com. ZOCDOC.com/vaccine en inglés, pero en español VACCI_NE. Y ahí se puede suscribir y recibir una cita para vacunarse. Como siempre, continúe visitando también chicago.gov/covidvax para que encuentre el buscador de vacunas y ver si ya es elegible y ver qué centros están cerca. Si conoce a alguien que sea elegible en estas fases y que no se ha vacunado, por favor ayude a esas personas a inscribirse y vacunarse. Ahora, este cambio a la fase 1C no significa que de entrada todos podamos tener la vacunación. Esperamos recibir más vacunas. Acuérdense, el suministro es limitado. Pero en el transcurso de estos meses, especialmente ya para abril y mayo, vendrán nuestras vacunas, o por lo menos así se nos ha prometido, y estamos muy positivos que ese sea el caso, y ya podremos vacunar a todo mundo que cae en la fase 1C. En este momento, aproximadamente 1 de cada 5 habitantes de Chicago ha recibido por lo menos su primera dosis de la vacuna. Y 1 de cada 2 personas 65 años o mayores ya han recibido por lo menos una parte de la vacuna. Esto no significa que estamos fuera de peligro. Todavía tenemos que hacer bastante para alcanzar esa meta. Y debemos seguir en alerta, practicando nuestras preventivas, las preventivas de mitigación del COVID-19, que significan siendo distanciamiento social de más de 6 pies entre un individuo y otro. Evite reunirse en grupos. Lávese las manos con frecuencias, por lo menos 20 segundos con jabón y agua. Y sigue usando una mascarilla y, importante igual, evite los viajes que no sean esenciales. Las vacunas han sido la luz en el túnel que hemos estado esperando durante más de un año, pero el brillo de esa luz depende de lo que hagamos ahora. E individualmente, para evitar que esta enfermedad ponga en peligro o se lleve más vidas y siga prolongando nuestra angustia y nuestro regreso a la normalidad. Así que, por favor, vacúnense. Y gracias a todos por escucharme y manténgase a salvo, Chicago.
I have a few questions for Dr. Arwady, and then from the pool, and then I'll turn it over to you guys. Dr. A, Allison from the Tribune wants to know if Chicago's list of underlying health conditions for Phase 1C is basically the same as IDPH's except smokers.
It's actually a little bit more extensive than IDPH's. We really have looked in a lot of detail at what the CDC has recommended, the ones that both certainly and likely increase the risk for severe outcomes. So all of the conditions that are included under the state's 1B plus are there, with the exception of smoking, as you note, but there are a few additional ones. We more specifically call out some additional immune deficiencies like HIV. We call out liver disease. Obesity remains in there with the BMI over 30. Schizophrenia spectrum disorders, which have been shown to significantly increase people's risk for severe COVID, sickle cell disease, thalassemia, but the full list is online. Broadly, it is similar with a few more additions where there is good data suggesting that people have more severe outcomes.
Kelly Bauer from Block Club wants to know if you have any concerns about Loretto Hospital's vaccine event at Trump Tower.
So Loretto Hospital obviously has been a major partner of ours all along. It's where we launched our vaccination campaign at the beginning, and they have done a lot of really excellent work vaccinating people, particularly in, on the West Side and in the Austin neighborhood. We have had conversations with Loretto Hospital related to that event, and we have asked for some more details related to who was vaccinated. Loretto has noted that their intent was to vaccinate hotel workers, and hotel workers are not eligible at this time. They do become eligible under 1C on the 29th of March, and they have noted that there was apparently some confusion over that fact. So we have made it clear what phase we're in, and we are continuing to make sure we have full information related to that. I will note, I think it was approximately 70-something vaccinations, in the context of course, nearly 1 million that have been done, but nevertheless, we obviously want to make sure that people are being vaccinated when it is their turn, and with a focus. It is not part of the Protect Chicago Plus initiative, and Loretto did make that clear as well.
Ryan Burrow from WGN Radio wants to know how Indiana is able to accelerate their distribution to those 45 and older.
So there is no one right way to do COVID vaccination prioritization. The way that we are going here is the way that the CDC and the ACIP have recommended from the beginning. That was based on a lot of work that was done in planning for COVID. It is based, I do believe, on the best available evidence. And we felt pretty strongly here that we wanted certainly to make sure that people with severe underlying conditions, adults, were able to be vaccinated regardless of their age. And we've asked providers to please work to vaccinate their highest risk people first, first. They're best able to do that prioritization. So that's on the underlying condition side. And then on the essential worker side, just recognizing that there are a lot of people in this city who have jobs that they cannot work from home and that they are at increased work related to their employment, felt like it was important to also open up eligibility. We know that a lot of people in that group also are from some of the hardest hit communities, and making sure that there is access in a way that both gets at people with the most severe outcomes from COVID, as well as the people least able to control their exposure to COVID, is the same approach that has been used in 1B, and we have elected here to follow the CDC guidance in moving ahead to 1C.
All right, last one from me before we go to the room. Dan Mihalopoulos from WBEZ wants to know if 1C includes Cook County judges.
So, oh my goodness. All right, so 1C.
And if he wants them to.
Yes, exactly. So 1C definitely includes legal. It includes legal services, and that would include judges, lawyers, paralegals, et cetera. We have been in separate conversations with Cook County specifically, and I know that there are plans related to making sure that people who are doing legal services, who are employees of Cook County, are being vaccinated. It's a little bit in the weeds, but broadly speaking, yes, people who work in the legal system are in Phase 1C, and again, there's more details online.
Okay, I think we're going to start with Michelle.
Thank you. Dr. Arwady, I actually have a question for you, which is, you mentioned that once we expand to 1C, this will include a majority of the Chicago population. Do you have exact numbers on that? What does 1C look like in terms of the percentage of folks in Chicago?
Yeah, so there's a lot of overlap between people who have underlying conditions and people who are in these essential worker categories. And so it does become challenging to get very specific numbers on that. You know, we had already estimated with the state's 1B plus that is more than 900,000, probably close to 1 million people. And it probably does add, our epidemiologists are estimating maybe another 300,000, something in that phase, in that range. It is a lot of people, like no doubt about it. But it is the move that we are making to continue to have some prioritization above the general population still. This is not your healthy college student. This is not your person who does not have a significant increased risk, who can work from home. We did want to continue to have some prioritization while making this available both for people with underlying conditions in there. So it is, between 1A, 1B, and 1C, it is the majority, but not all, of Chicago's population.
And just one more question, not to jump the gun on this, but you did talk about it briefly on your Facebook Live yesterday, which was opening up to the general population, which of course is Phase 2. And originally, I guess the estimate was the end of May. And you were saying that it's possible this could be done even earlier in May.
Yeah, so if you'll recall, what we laid out all the way at the beginning of December was a best estimate in terms of what we were assuming we would see related to vaccine supply. I actually think we did a pretty good job guessing there. We guessed sort of March 29th would be approximately when we would be ready. We guessed, end of January, 1A to 1B, end of March, 1B into 1C, and then we had assumed end of May, really, to go from 1C into 2. This is really in response to what President Biden said, where he was calling on all jurisdictions to have vaccine eligibility for all Americans by May 1st. I would be thrilled to be able to do that. I anticipate that we would be able to do that, but I want to make sure that we see the vaccine supply. And certainly, they seem very confident that the vaccine supply will ramp up even more. There's a couple of vaccines that are still may come to fruition, like through the FDA in April and May. That would be the AstraZeneca and the Novavax. And so certainly if you have additional vaccines in your pool, that would dramatically increase our ability to vaccinate more people quickly. So there are still a few unknowns. But yes, I think we are expecting, based on what the federal government has said, that in the same way we're moving to March 29th for 1C, I think if things are on track the way they're expecting, probably May 1, we would be able to move ahead to everybody. But we're going to just be sure that we actually have the vaccine to be able to do that.
I wanted to come back to the Loretto event. Do events like that damage the transparency and the equity that you've worked so hard to establish up to this point? Were you disappointed to hear about that?
Of course I was disappointed to hear about it. As Dr. already said, Loretto has been a tremendous partner with the city and really not only making sure that its entire, I think they were 90+% of their staff have been vaccinated, which is a tremendous record, but also being an incredible partner on the near west side. I think they've owned responsibility for this. They know it was a mistake. I've asked Dr. Arwady to dig deeper to make sure that to quote a phrase, to trust but verify, to make sure that what they told us, the COO who decided to host this event, that it was limited to hotel workers and not some other circumstances. But they recognize that this is a mistake and absolutely can never be repeated, and it's a cautionary tale for any other provider. We have a finite amount of vaccine in the city. We've been really, really careful to make sure that we're using it in a way that prioritizes the most vulnerable people who are most at risk and the most at risk of spreading it. We're not going to do what we've seen in other parts of the country, just have a free-for-all. So this is one event. I don't think it overall affects the hard work that we put in to make sure that this is a distribution process that really begins and ends with equity, but we just can't have something like this happen again.
Mayor, Dr. Arwady, what happens if supply isn't what you think it will be? There are people who would like to get a vaccine now, but they still can't. We've done half of people 65 and older. You say, so what happens on the 29th if even the people in this room presumably would be eligible under the increased eligibility? Who gets priority? Would we be able to sign up over the person 65 years old who hasn't gotten the vaccine?
Well, I'll start and then I'll invite Dr. Arwady into the conversation. As we said, we're going to continue to prioritize those people in 1A and 1B as we open up to 1C. We are moving in this direction not in a vacuum. We're moving in this direction because of the progress that we've made, but also because of the frequent conversation that we're having with the Biden administration's top leadership that is running point on all things related to vaccines and the COVID response in general, and based upon what they're telling us the supply is going to look like. So we're not doing this on our own. We're doing this based upon a lot of conversations and a lot of predictions about what the supply is going to look like. And even then, as hopefully you have figured out, we're very conservative in our approach because we don't want to overpromise and underdeliver. That's a disaster, and you've seen that happen in other parts of the country. That's not what we want to have happen here in Chicago. Doctor, I don't know if you have more to add to that.
Yeah, I would just underscore that you heard both of us say we're opening March 29th, but we're really talking about people being able to be vaccinated in April or May. And a lot of folks are going to be vaccinated in May, realistically. And that's not different than 1A, that's not different than 1B, but my concern, as we open is that, right, people will think magically there is a huge supply that starts March 29th, and there isn't. But we will have received by that point enough vaccine to have gotten through, the very large majority, around 3/4 of the people who would have been eligible in 1B. We know we've been vaccinating non-Chicago residents as well, and all signs are looking good in terms of the ability to really ramp up. So I know a lot of people are anxious to be vaccinated, and I also know that April is probably going to feel frustrating for some of them, especially early April. But by late April, and into May, I do think that we will be at a point that is going to start feeling more like a typical flu vaccine. And there are settings around the country that have not done that much more vaccinating than we have, especially small, limited settings, that are starting to see that supply-demand shift. And we are way ahead in terms of having the ability to get vaccine out as it gets here. So I've got no concerns on the planning or the distribution side. It's just, will the vaccine get here? And they're telling us really good news at the federal level, so we're believing it and moving ahead. But again, April, May.
Do folks in A and B get to skip people in 1C and line?
Yeah, so this is what gets a little bit complicated. What happens, where you're thinking about ZocDoc.com, for example, is that, you'll be able to check off your broad eligibility and it will be who's able to make an appointment. Where we have more ability to do that prioritization, a lot of this does come through our healthcare providers. One of the reasons we did very well, I think, in terms of getting a lot of our oldest folks vaccinated first, and a lot of, we had much better race ethnicity data than a lot of cities did for that oldest group, is that we asked providers to start with your oldest, highest risk patients. And we have asked them to do exactly the same thing. You know, even now, if they have vaccine that they don't have people over 65 to do, you know, can start their folks who have these underlying conditions, and then we'll be formally in that starting March 29th. But it is going to be harder, honestly, for people over 65 to get a vaccine after March 29th. We'll do everything we can to prioritize them. When they call the call center, we will work very hard to get them in, and we'll be asking everybody to keep prioritizing. But that is why, you know, today's 17th. We've got 12 more days here. If you know anybody over the age of 65, please, anywhere in the city of Chicago, we want to get folks vaccinated. Call that number and we'll get you an appointment, because it's going to get a little harder after that.
Hello, Mayor, this is Coco from Chinese TV station Sinovision. At the beginning, you mentioned Atlanta shooting is a hate crime. So do you have any evidence?
I apologize, but I have bad hearing, so I'm having a hard time hearing you through the mask. Maybe you can just talk a little bit louder.
Sorry, this is Coco, is a Chinese reporter from Sinovision. At the beginning, you mentioned Atlanta shooting is like a hate crime. So do you have any evidence, or why you think that is a hate crime?
Look, I think the fact that this shooter, who obviously is entitled to a presumption of innocence, went into business venues that were staffed by primarily Asian individuals and shot them, says to me this wasn't an accident or random. And given that he went to 3 different locations, that he targeted Asian women in each of those locations, says to me that this wasn't anything random, that it was intentional, and it feels to me, as a former member of law enforcement, like a hate crime.
Mayor Dr. Arwady, Marie Saavedra with CBS 2. This might be better for you, Doctor. I'm curious about the United Center. I know yesterday on Twitter your department was shooting down rumors that there are appointments and vaccine going to waste at the United Center. Can you tell us how many appointments are being booked? Are you at capacity? Is vaccine moving to another day? If you can clear up anything on that issue.
Sure. So let me start by reiterating, no vaccine is going to waste at the United Center or anywhere in Chicago. And yes, we are at capacity at the United Center. We are booking up to 5,700 appointments per day right now, and we are doing more than 5,600 appointments of those yesterday, for example. And we are not at, there's the capacity to do a full 6,000. We've held it to 5,700, partly because we are also opening a drive-through next week. And so making sure that there is the ability to support not just the walk-through, but the drive-through. We will have additional vaccine that will continue to be Pfizer vaccine, to be very clear. But there will be both walk-through and drive-through capabilities. So every vaccine is being used. There is no vaccine going to waste. Eligibility has not changed there, and we're really humming and doing a good job.
Any concerns over St. Patrick's Day celebrations or habits that people should keep in mind, even though many are getting vaccinated?
Yes. So, I said last week that green beer does not protect you from COVID. That remains true. And, we need people to keep being smart here. We are very pleased with the progress we've made on vaccination, but still, just over 10% of people have gotten both of those doses, and you've got to be 2 weeks post your second dose of vaccine before you're considered fully vaccinated. And regardless, we can't have people out. We're not at a point from our COVID numbers where we're ready to think that COVID is over. And so, we and the business affairs and consumer protection folks were out over the weekend. Really want to thank people, at restaurants and bars who are doing a good job of making sure that the COVID restrictions that are in place just to keep people safe, just to keep us moving forward. All we want to do is to continue to cautiously reopen or remain in place. So, I'm wearing my green, but I'm not doing any St. Patrick's Day celebrating myself. And I think recognizing that we've had a different St. Patrick's Day, there's still some river dyeing, still some things that we were doing to celebrate, but we are not, to be very clear, in the middle of March, ready to be having large gatherings and thinking that COVID is behind us.
Great, we'll do our last one for Eric.
Thanks. Dr. Arwady?
For you.
You're popular today. Wondered if you could
press conference where I come, I speak, and I get nothing. Keep it up.
had any, you said that there were going to be more mass vaccination sites when we get more vaccines. Are they going to be operated by Prism Health? They were announced in February to be the vaccine.
Yeah, so a couple things are happening. So yes, Prism Health is one of our contractors. They will be part of mass vaccination efforts. They may not be the only one, but they are part of what is happening related to mass vaccination. We're working with all different partners on different mass vaccination plans.
Any sense of specific locations, specifically on the south side? Sometimes I think said Wrigley Field was going to be a site at one point, but I didn't know if you had any sense, particularly in my area and the Hyde Park, Mid-South Side area, any other locations that were under consideration?
Yeah, so there are a lot of different locations that are under consideration. I expect we'll be making some additional announcements probably in the next few weeks to come here as we get additional vaccine and are able to kind of announce that more formally. We never want to commit to a mass vaccination site until we know we've got the vaccine to support it.
And then one other question, I'm looking at the data on the reopening metrics right now, and everything's in lower risk except for diagnosed cases,
Correct.
which is still in moderate risk.
Correct.
We're seeing bad signs in Europe right now because of the variant spreading. Washington Post reported that there's rising infections in the upper Midwest and New York metro area yesterday. Any sense of what's going on in Chicago, what we can expect to see over the next couple of months?
Yeah.
You have good epidemiologists.
Oh, just a short question. Okay. Certainly, our epidemiologists are looking every single day at about 8 different metrics for any sign of any trouble. We have continued to see very good news where we look at our severe outcomes, our hospitalizations, our ICU visits, our deaths. Our cases, as you note, are not at that lower rate yet. I really need those to get under 200 cases per day. As of today, we're sitting at 293, just under 300, but not where we want to be. And so seeing those numbers hopefully trend down is a big part of what we're watching for here. We're sitting at a 2.9% positivity today. Again, this is good. But we're not done. And so I am concerned about some of the increases that we've seen in Michigan, for example, which is very near us, has had a lot of variants. Things are broadly in control, but they've had real increases. And this is where, in some ways, we are against time here. I feel really confident in the vaccine strategies that we have because we've gotten vaccine into the places where the most COVID cases are being driven, which in turn are where we see variants emerge and spread. So I think that is going well. Getting people vaccinated, getting more vaccine here, and not having people think that COVID is over. These masks, the social distancing, they protect you from the variants, but you got to keep doing them. So we need people to hang in there while we continue to get a larger population vaccinated and keep monitoring variants. But, I think I'm feeling okay about where we are right now. And if we see any signs of trouble, certainly, we won't hesitate to act.
Thank you. All right, thanks everybody.